Good afternoon. This is Barbara Manuzzo, and I'm here with Professor Mikhail Grivna. He's from the College of Medicine and Health Sciences from the United Arab Emirates University. And today he's with us to speak to us about his work with child safety.
Good afternoon.
Professor Mikhail Grivna, please tell us about the work that you've been involved in terms of the child safety.
It is quite a complicated question. I will try to explain my experience from both countries. I'm originally from Czech Republic, and I was leading the Center for Childhood Injury Prevention and Epidemiology. And of course, now I'm working in Middle East, in Al-Ain, and both these countries differs by the different risks for the childhood injuries, different data sources, and different means. So, for example, in Middle East, we have a huge challenge with traffic-related injuries. Many kids are dying. The safety features are not still enforced. So, child car safety is only introduced to the society, and awareness is increasing, but it is not legislation mandated. So we have still a lot of children who are dying from traffic-related injuries. Another issue are traditional value and traditional thinking. For example, in Middle East, the traditional thinking about the destiny or evil eye is quite strong. So this is barrier for the injury prevention efforts. So we need to explain to the families that injuries could be prevented and safety features should be employed to save the lives. So, for example, we have huge challenges with baby walker use. So 97% of the families, by our research, are using baby walkers. Only in a small town where I'm working, it is 500,000 people aligned. It is quite nice, very green town in the desert, close to Dubai. We had recently 3 deaths related to use of baby walkers. So it is quite interesting. Some countries it is already known that baby walkers are banned. For example, Canada is banning the sale and resale and import of the baby walkers. So we are using different approach. Now we are in some randomized control trials. So we are trying some intervention related to the home safety. So it is including the inspection of the homes, and it is quite a barrier because traditional families are not really so open for some outsider to enter the family. So there is quite interesting gender issues and barriers to the local families. So this is quite interesting. We are using also new means, and it is by the messaging. So we are measuring if the messaging, so there's messages about the home safety instructions are useful or not. So it will be quite interesting to see.
So, Professor Mikhail, in terms of how you're sending the messages to the families, are you using brochures, posters? How are you sending out the messages?
To find out if our methodology is efficient or not, so we have the control arm, intervention arm. In intervention arm, trained teams are going to family homes. So, and by families are selected by the primary healthcare physicians or pediatricians, and then the special team is invited to see the home. So they are filling the home safety checklist with the parents. So they are going to all the rooms and checking for safety features. They are leaving them safety baby box. If it is small children, there are different for window safety, for some prevention of the opening and the kitchen and so on, some safety equipment, locks, and of course they are leaving them the brochure. So then the next stage, it is reinforcing the safety messages. So we are sending to part of the intervention arm families some SMSs with graphics and with some safety features, and it's regularly messages during the year. So we would like to measure if this intervention using the safety messages is more efficient than only with the brochures.
I really like the idea of how you're really utilizing the new way of going forward with using the mobile phones, our infographics and everything, and really keeping the messages really simple and visual and bringing it to life with all the images and everything. That's really fabulous. And also to act as reminders and prompts and keeping it very simple so that the families are reminded that we're there to support them, to prepare the environment as safe as possible for those seconds that they're not looking, or just generally that we're there to support them in keeping their children safe?
I think it's very important because now in the new era, especially the young parents, they are all using the mobile devices, and despite the social barriers, so even if it is poorer families, still they have the mobile, and they're using the mobile for all the means of communication. So I think it's very important to find out if this mean is efficient or not. Of course, we are not speaking that it is the best mean. We need to measure if it will really decrease the number of injuries or not.
Thank you, Professor Mikhail Grivner. We look forward to hearing how, once it's been measured, how effective it's been. So thank you so much.